Namaskar. Terry Reynolds once said, "It is tough to talk about the middle ground when it comes to fundamental rights." She was obviously talking about healthcare in the United States. The point of access and quality of healthcare in India and abroad has been a pertinent one, which has been debated time and again, and yet there remains so much to be done. Today we have with us a very special guest, Dr. Sunny Anand. I would firstly like to welcome Dr. Sunny Anand.
Thank you very much. I'm delighted to be part of this program.
Thank you. Dr. Anand is a professor of pediatrics, anesthesiology, perioperative, and pain medicine at Stanford University School of Medicine. He's considered a world authority on pain stress in newborns and pain management in infants. As a Rhodes Scholar at the University of Oxford, he completed his DPhil, followed by a postdoctoral fellowship at the Harvard Medical School. Dr. Anand founded the Harmony Health Clinic, the largest charitable medical and dental clinic in Little Rock, has worked with the Heart to Heart Foundation, and also to remove interfaith conflict through the state of Arkansas. Besides his numerous awards and accomplishments in medicine, he has also received the Father Joseph Blitz Award in 2007 from the National Conference for Community and Justice, and the Dr. Martin Luther King Salute to Greatness Individual Award in 2008 from the Governor of Arkansas for his commitment to community service. We're really privileged to have you with us today.
Thank you very much for that kind introduction.
We will start by asking you, Dr. Anand, to please share with us a little bit about your background, where you're from, and your journey till now, please.
Certainly. Thank you for that opportunity. I was born in India. I was born in Ludhiana and lived in the Punjab till about 2 or 3 years old. And then we moved to Calcutta, where I spent my early childhood, and then moved to Indore in Madhya Pradesh. That's where I spent the latter part of my childhood and went to college and medical school in Indore. Basically also, after finishing medical school, went to Delhi, where my parents had moved while I was in med school, and did my internship over there, then came back to Indore for postdoctoral training in pediatrics. While I was doing that, applied for and got the Rhodes Scholarship. So that was my ticket to go to the UK. Spent three years and a few months, very glorious years and months in Oxford. Really, it was coming from, the small town India. Indore was still a very small town at that time. And getting exposed to, people who are at the forefront of their fields. In a place like Oxford was really a very enlightening experience. And then was lucky to get, I actually had plans to finish my PhD or DPhil at Oxford and then come back to India, look for a job. But that's when 1984 happened and there were widespread riots. And so in early January, February 85, when I was starting to apply for jobs, my parents said, this is not the right time. And so in the meantime, the chairman of anesthesiology at Harvard Medical School, invited me to give grand rounds at Harvard in the Ether Dome that's located, the first Ether Dome is where the first demonstration of general anesthesia was held. And then at the end of my talk, he offered a job. Anyway, that was a long story. I've been in the US since then, mostly trained at Harvard for about 8.5 years, finished my residency and clinical training over there as a critical care physician. And my passion was to be where there are underserved populations. So we moved to Atlanta, to Emory University in 1993, and then 4 years later moved to Little Rock, Arkansas, where I spent the bulk of my career and went through the academic ranks, from being assistant to associate to full professor, and then received an endowed chair also at the University of Arkansas. And that's where, there are, I saw very clearly there were very underserved populations. The mortality rate of children in the state was about 3 times the national average. And that was, for the entire Mississippi Delta region. That includes Arkansas, Louisiana, some parts of Alabama and eastern Texas. So that's sort of the Mississippi Delta region. It's the most underdeveloped, under-resourced area in the U.S. And so had an opportunity to, help, move the needle with the help of many, many other people in improving critical care services for children. And then moved to Memphis, Tennessee in 2009, where I had direct access to most of the hospitals in northern Mississippi, and was able to help develop trauma networks and transportation and critical care for the children over there. So at the end of 2014, we had done a study to show how mortality rates had come down to where they were at or below the national average. This is age, sex, and diagnosis matched, comparisons. So at that point, I was thinking, what will be my next challenge? Which is when Stanford University recruited me to be the chief of critical care medicine over here. So I moved to Stanford about 5 years ago and have really enjoyed working with the top-notch people over here.
Yeah. Fantastic, and that's such an interesting journey, and so many contributions in myriad ways. I was particularly interested in your contributions towards improving access and quality of healthcare in India. So if you could please let us know about the directions in which you have contributed over the years in terms of improving the access and quality of healthcare in India.
Yeah. Thank you. That is a very important, like I said before, I was born and brought up and grew up in India, got my medical training over there. And so there is a very deep emotional connection to India, its people. My in-laws and my father are still alive, so frequently visit India. And then over the years, what I found was people who knew me or people who knew somebody who knew me would refer their children, and I would organize for their child to come to the U.S. and get the best possible care that money could buy, or that we could organize for that child. And this really led to a big concern. Also, I had done my pediatric training in India, so I knew that pediatrics was not a very high-paying specialty. Basically it was under-resourced compared to many of the other adult-based specialties. So for many years, actually starting from 1999 till about 2009, I was trying to help various entities start a large tertiary care or quaternary care children's hospital. And served as in an advisory capacity to multiple different groups, Apollo, Fortis, Wockhardt, Max, many of these health groups. And at one point, we had put together this proposal, land was purchased, construction was started, and the understanding was that I would move back to India and be the, director of this children's hospital. And all along, we had talked about this being a non-profit, a not-for-profit hospital, because I saw how the commercialization of healthcare in India had really disregarded people at the lower end of the socioeconomic spectrum. and once the hospital was ready and I'd helped with the equipment and things like that, the board decided, oh no, it's not going to be sustainable as a nonprofit, that we would have to make it into a for-profit hospital, which was very disappointing because I was literally at the point of signing a contract to be their employee. And I said, well, if that's what you're going to do, I'm sorry, I have never ever worked in a for-profit thing, and I just wouldn't know how to be effective in that. My thing is, if there is a child, we've got to do something about it. There's no reason for holding back the intensity of services and the quality of services that we offer. So over the years, I've been to India many times, have consulted on critically ill patients in a few hospitals, and have been there for multiple conferences, giving talks on my area of research and things like that. But it was not until very recently, the earliest I think was 2016. Maybe a little earlier than that, maybe 2014 or so, that I came across this hospital, this tiny little hospital in the middle of nowhere near Raipur. And interesting, the fact that they offer all of their services completely free of cost, that the parents, the families don't have to pay for anything. When I went, and we were just amazed to see at the quality of care, the professionalism, the compassion with which everyone treated, and they were taking the most difficult of all areas. They were focusing on pediatric care, not the simple runny nose, diarrhea, this, that, or focusing simply on breast, and I've been associated with the Sanjeevani hospitals since then. Now there are 3 of them, and very soon there'll be a 4th.
And right, so I mean, and you have seen the evolution of healthcare as well over the decades, given your experience. So how do you see that evolution happening in India in terms of various points that you raised as well, in terms of let's say the access and quality, of course, but also the commercial and government involvement, and the way in which it has reached out to the last mile, to the last kind of same time. So how do you see that evolution happening, which has happened over the decades?
Yeah. So I feel that the sort of formal healthcare system is a very rapidly developing sector in India. And obviously the population is huge. The areas that need to be covered are vast. And so there are real challenges in the actual delivery of healthcare. And I think there's a lot of innovation happening in terms of telehealth and, telemedicine and telehealth. We got on a boost from this COVID-19 pandemic and the lockdowns that we've experienced for this last 6 months. So I think that's how I feel healthcare will be progressing. Is it's more each individual is getting educated as to what quality of healthcare they deserve. In India, most people didn't know what is quality health. They were just grateful for anything that you did on health, and they are able to request and demand, good quality care. The other thing that is happening as the health literacy goes up is that people are taking more preventive measures and not just curative measures. So I think controlling diet, lifestyle choices, things like that, there's a certain attention to that. The other thing I see happening over the next decade or so is a realization that the Western style of medicine, the allopathic medicine, is not the only type
Right.
of medicine that is available to Indians. And other types of medicines and health, promoting health. You see, the Western systems of medicine were built on the death and disease model, starting from the great innovators, the great inventors, Louis Pasteur and Koch and Lister and so on. It was based on who's the sickest and how do we help them. So it's a disease-based model. It's not generated to provide health and well-being. And so we're regularly, we have, even now, even today, in leading journals, we have what are the leading causes of death, and disease. Programs are developed to address those diseases and disabilities, and but that's like a reactive mode of dealing with healthcare. A proactive mode would be, what are the leading causes of life, and how can we support that life to come into a state of well-being and health, so that those things don't even happen. And so I think there will not be enough insulin in the entire world to treat all the diabetics in India. Never will be. But if we can empower people to, use naturalistic approaches or use their own dietary control and things like that, then I think we can prevent the epidemic of Indian diabetes, that we're seeing.
Absolutely. When it comes to your initiative itself, I mean, in terms of the finances, because we do have various NGOs and other bodies which have been working in the healthcare sector in terms of making it more accessible, but it is fairly kind of in certain isolated instances that you provide tertiary and quaternary care, as well as healthcare in various parts of the country, which are free of cost and which are of certain quality. So I would like to know about the finances, how to kind of support the initiative itself, and various details about that.
Okay, sure. So I assume you're talking about the Sri Sapta Sai Sanjeevani hospitals. These are hospitals. So just to give a broad overview first, the hospital in Raipur was inaugurated in 2012, and it was only in 2014, February of 2014, that they changed their mission statement to focus only on they opened as a heart hospital, and it was open for children, adults, etc. But there were many heart centers coming up all over the country at that time for adults, because it's simply easy to do a bypass or an angioplasty or things like, or a valve replacement, which is the 4 or 5 major things that adult heart disease is all about. But on the pediatric side, there are 64 different congenital malformations, and there was at that time 300,000 children being born with congenital heart disease. Less than 1% they were getting any kind of care. And the care, wherever it was delivered, was extremely expensive. So most families just could not even dream of getting good quality care. So in February 2014, they decided we will focus on pediatric congenital heart disease. And then in 2016, a second hospital was started because just the volume was so much at this little hospital in near Raipur. So a second hospital was opened in Palwal, which is part of the NCR region. In 2016, they started operations in 2017. And then a third hospital has come up in 2018 in Navi Mumbai, in the Kharghar district. of Navi Mumbai. So now there are 3 hospitals, and very soon, with God's grace, God willing, of course, there will be a 4th one coming up in the Calcutta area, in the sort of West Bengal area. So these are hospitals that provide medical, surgical, post-operative, care, but they also have these outreach programs where they're screening, thousands, tens of thousands of children every month. And when I went to these hospitals, the care may be free, but there is no compromise on quality. So they provide, the top quality, and they have much better results. They have a mortality rate of less than 1%, which no other hospital in India can boast of, or even aspire to. Less than 1% is where Stanford and Harvard, these are big heart centers in the world. We are very proud to be. But this little hospital in Raipur has achieved that, and achieved it, much faster than we did. So the quality of care is extremely high. They've done about 10,000 surgical operations, and they have a 0% post-operative infection rate. Even we can't, with all the resources at Stanford or Boston Children's Hospital or CHOP in Philadelphia, or even Great Ormond Street in London, and Zurich Children's Hospital, or Westmead Children's Hospital in Australia, in Sydney, none of these can boast of a 0% post-operative care. But when I went there and I saw that the operating rooms are cleaned every 30 minutes. They have such a great focus on the quality of care that they deliver. It's beautiful to see that kind of. If I had the opportunity to serve in an institution like that when I finished my training, I would have never left India, literally. So that is there. How are they funded? Well, it's a mystery. They're mostly funded through, they were initially just funded through philanthropy. And this was not the big donors, like the Gates Foundation and, those big, it was the little people. It was people like you and me. So philanthropy is a large part of it. Over the years, as they have grown in stature and in their the extent to what they services they offer, there are various corporations that are now supporting, care. For example, there was a foundation that is supporting, all the children of truckers, are being supported. If they have congenital heart disease, they get, free care. And what's important to point out is not only is the care completely free, but when the parents come there, they get a place to stay. So they get free accommodation. They get free food as long as the child is in the hospital, for, both the parents. So it's really based on the destitute, the people who have nothing. Even their children get the gift of life through these institutions. And so some corporation support is there. And also now that there have been some, public health insurance policies that the Modi government has put into place. There is, they have gotten grants previously from the hospital, from the various state governments, but now there is, some insurance payments that also occur. I must add that when you go to the hospital, it's amazing. There is no cash counter. There's no billing department. there's no accounts payable or receivable. It's just not there. You just don't see it. All you see is love and compassion and professionalism and good care. That's all.
Amazing, amazing. I mean, especially the point about the post-operative infection rate. I mean, that is just absolutely amazing. Because I personally, my father recently had a bypass surgery and at my Max in Delhi, and we were talking to the doctors, and even there, I mean, you have significant rates of post-operative infection. So it is amazing what you mentioned there. Speaking about outreach, because you briefly touched upon that. Awareness and outreach when it comes to healthcare is an important issue and something which is still lacking in some ways. Studies on awareness have been many and diverse, and there is a lacuna of understanding and awareness across the country. Adequate knowledge regarding things like breastfeeding, for instance, in 1/3 of antenatal mothers in the country in a recent study, or in urban Haryana when they saw that 11.3% of adolescent girls knew about key reproductive health issues. And the same is true for health diseases as well. So how do you see the status quo when it comes to this particular issue? And what do you envision as a strategy to effectively move forward to addressing this point?
Yeah, I think the health literacy is a very, very important thing. And that fortunately over the years I have seen huge strides being made. uh, I think there were a few sort of stimuli along the way. For example, when AIDS came out, there were various NGOs and government agencies that got into action and really disseminated the right information about AIDS. And not only to adults and youth and adolescents, but even to little children, where they had these cartoons and they had various Bollywood actors whose caricatures would be made up, and they talk to the child at their level. So those kinds of health literacy campaigns, the breastfeeding initiative definitely has been a major thrust forward, because no matter how much you spend on these public awareness campaigns, the formula companies are spending 200 times more on their advertising. And they will show healthy babies and how anyone who gets this milk powder or that supplement will sort of thrive. And it really doesn't ever happen that way. I was quite frustrated even when I was in India in my training to see how these pharmaceutical companies were literally milking the masses of based on their ignorance. Basically, their entire business model was based on where is the least literacy and let's get the most we can out of those children. So I think that health literacy is a very important thing. COVID-19 certainly has helped. As you can see, it has been very effective, at least in the initial part of the pandemic. The way India was able to control transmission at the community level was just amazing. And the public health infrastructure that India has built over many decades, was put into very effective use. Now that things have relaxed a little bit and there is a little more commerce and other things happening, the transmission rates are going up. But it is clear that the mortality rates from COVID-19 in India are 1/10 or 1/20th of what they are in developed countries from Europe or the US and so on. So I think much more needs to be done in that regard. Particularly the issues that you mentioned about, reproductive health. Only 11% of adolescent girls know about that, and that really is a shame. That is something that literally should be the trigger to start massive efforts towards proper information being given to these young girls. I'll give you one example of how Google and Tata Trust started this thing called the Internet Sati program. Google did a study to see what is the ratio of men to women using the internet. In urban areas, there were sort of the ratio was about sort of 1:2 or 1:1, 1.2, something like that. It was for every 6 men who were using the internet, there were 4 women. But in rural areas, they found it was for every 10 or 12 men who were using the internet, there was 1 woman. And so they felt that the penetration into rural areas was very, very poor. And so they, did various workshops, and they went to many villages and, did this. And then 3 months later, they went back. This was only focused on women, introducing women to the smartphone and what it can do for you. When they went back 3 months later, contacted the same women, they found that hardly any of those women had purchased a smartphone. And even if there was a smartphone in the house, it was women were not allowed to touch it. So they started this thing called the Internet Sati program, where they invited women who were champions for their village. They did a 2-day course for them on how to access the internet and what are the things you can look up and things like that. And they gave them 2 devices. One was their own; they had it. One was like a demonstration device. And so these women were told that maybe 50 or 60 people in your village, women, you focus on teaching them what are the benefits of going on the internet. Well, each one of those women, didn't stop at 60. Each one of those women taught the internet and demonstrated its benefits to like 600, 800, 1,000 women. And so in the short span of about 2 years, 54 million women have been accessed. And, so there are now areas in the country, large areas in the country, where, the rural penetration, particularly for women, has been massive. It's like at 95+%. So that certainly is one way of getting healthcare information out. And they have on the app, the Internet Sati app that they have access to, weather patterns, agricultural help, So they found that 80% of the women who started using the internet were able to get some economic benefit for themselves in terms of selling their products or learning new skills or monetizing what they were already doing at that point. And so, they've triggered entrepreneurship at a massive scale. And so those are the kinds of things that can happen. Of course, the program only expanded after Tata Trust gave, and Google together, they created this joint venture. And so the Internet Sati program is really a success story that needs to be replicated and expanded. So I think that's how knowledge will spread. That's how people will learn that I should not be content. This is not Bhagwan ki kripa hai कि भाई अब मेरे जोड़े नहीं काम करते या मेरे दांत गिर गए हैं. That's not the issue. They should be able to see the possibilities of enjoying much better health and simply not accepting the status quo that they've lived under.
I mean, very important points there. I mean, and when it comes to outreach, you've addressed some very important points, but also about physical reach, right? So, I mean, physical reach is a basic determinant of access. And I think it is defined as the ability to enter a healthcare facility in about 5 kilometers from the place of residence or work. And a study in 2012 found that in rural areas, only 37% of people were able to access IP facilities within a 5 kilometer distance, and about 68% were able to access outpatient facilities. Given recent developments with COVID, this has become even more difficult for certain people. As an experienced medic, how do you see this being addressed? And have any innovative solutions been devised or introduced, let's say in your initiative, to kind of work around this problem?
Yeah, absolutely. So there's a lot that is going on. Telemedicine, telemonitoring, telehealth. These are major areas where a lot of innovation is happening. No question about it. Let me go back to the Sri Satya Sai Sanjeevani hospitals. What they realized is that children were coming to them at the brink of death, literally. They were in such advanced case with severe malnutrition, multiple infections, parasitic infestations, multiple other conditions, which was making it difficult for them to get treated for the congenital heart disease, the problem for which they had come. So they started in Chhattisgarh. That was the first place, and they started sending their vans with one doctor, one nurse, one paramedic, and few other volunteers into these remote areas. And they started screening these children. They came up with an amazing innovation where they had a list of 31 different conditions. Talk about the most advanced quality in healthcare initiative. They came up with these a checklist of 31 conditions where which incorporates the 4Ds. So let's see if I can remember those. So one, they looked for diseases. These are the childhood diseases that are common, including congenital heart disease. Then they looked for deficiencies. So iron deficiency, calcium deficiency, other vitamin deficiencies, and things like that. Then a third they looked for were disabilities in these children. So some children had maybe birth asphyxia, and so they had cerebral palsy, or some children had, eyesight problems, hearing problems, all those disabilities they looked at. And then the fourth thing they looked at was so diseases, deficiencies, disabilities. Anyway, it'll come to me. So they came up with this screening program, and now about 90,000 children have been screened. So it's amazing what has been done with very little, outlay. Similarly, we had there was a group of IT people over here who were inspired by this model, and they developed a bus, which is called the Sai Wheels bus, where they have a classroom, a fully digital classroom at the back of the bus. In the front half of the bus, they have a medical clinic with everything, with point of care testing, with ultrasound, with X-ray. Everything is part of that. And they made this bus, with solar panels on the top, so it was grid independent. It didn't matter whether there was electricity or not. And they had a nano filtration unit, built into the bus, so they could offer clean drinking water wherever they went. And so there are several of these buses that have been deployed and are now functioning in Bengal, in Karnataka, in Telangana, in Tamil Nadu, a few states. And in fact, other developing countries have asked for the prototypes, to be built and sent to there. So some of these initiatives are going on where there are weekly visits, to different villages, and that is. So I think that's how the healthcare, the last mile in healthcare delivery can be solved, is through telehealth, through these remote access, methodologies, by which we bring healthcare to the patient rather than having the patient give up a day's labor, a day's, milking their cows or this thing, go to a hospital, wait in an outpatient department, get exposed to 5,000 other diseases at that time, and having to pay for all of that. I think this is a much better model to decentralize the way the healthcare is delivered.
I think we now have addressed outreach and awareness and access as well. But one other point which is very important is that of quality. I think it was a National Rural Health Mission study, which there was a study based on that, which showed that of 6 states in India, which showed that many primary health centers still don't have medical paraphernalia. There's problem of infrastructure, for instance. More importantly, with the recent COVID outbreak, there has been the point about quality of PPE kits and the supply chain, so to say, when it comes to medicines and other elements which are required. So in your kind of initiative, what are the challenges that you faced, especially in this period of the pandemic and otherwise? And how do you ensure that there is high quality and customer satisfaction or service satisfaction, I should say, when it comes to the work done by your initiative?
Yeah. So I think the only way to ensure high quality is to treat every patient, every person who accesses the hospital as God. To literally offer our devotion without, you can have all the technology, you can have all the resources, and you can pay people, etc., etc. But until there is a feeling of compassion, until there is a feeling of dedication and devotion, and so India has this tradition of Atithi Devo Bhava, and so the amazing thing is that at these hospitals, everyone, every child, every parent, every employee, these are just the garments of God, and when you come from that mindset, then sure, quality standards need to be raised and maintained. But when you're coming from that mindset, you go far above and beyond the call of duty, far above and beyond the quality that you can. The janitors at Sathya Sai Sanjeevani Hospital are not told that they have to sweep the floor every hour. They just do it out of the love in their heart. And so I think the technology will help, the access will help, but without this spiritual component being added, it's never ever going to reach where we want it to reach, and so this needs to be the attitude at all the hospitals, at the Medantas and the Apollos and the Max hospitals or whatever other commercial this thing is. Everyone who works in is not a client, is not someone from whom we can earn the maximum rupees that we can, but is a part of myself, is more dear to me than my beloved wife and children, or my beloved Ishta Devta, whoever that may be, whether that's Jesus Christ or Muhammad or Ram, Rahim, whoever it is, Krishna. So it doesn't matter. I think that's the way forward in changing the mindset of people and treating each person as you would treat yourself, as you would want to be treated. And I think that attitude is slowly coming. It's coming more. into these NGO-run nonprofit hospitals. It's also coming to government hospitals. I've seen it in that, where people will do a good job simply for the joy of doing the good job, the best that they can do. And time again, I've been surprised with my mother was ill. She was critically ill in Bangalore. And so many times, the nurses would come and check on her every 15 minutes. They're not required to do vital signs, more than once an hour. But out of the goodness of their heart, they were coming to do that. And so I think this is a model that is slowly seeping into the hearts of people. And I think the hospital administrators are still unaware of this. They don't really know how they can improve productivity, cut costs, and enhance outcomes if they bring this aspect into, if they just change their focus a little and say, okay, how can we build customer value? I'll give you an example. When the bombing occurred at the Taj Mahal Hotel in Bombay, 34 people died. On that evening, that night, there were 1,800 guests in the hotel. Out of the 34 people who died, 17 were staff members, 17 were guests. There were less than 500 staff members, 1,800 guests. This is the kind of training that the hospitality industry, particularly the Tata people, have taught them, and they have made each staff member as an ambassador for the guest who's staying at the hotel or coming to the restaurant. So why cannot that happen in the hospital? Of course it can happen. And administrators need to learn from these models that are literally under their nose, and be able to incorporate that into the delivery of healthcare.
Absolutely. I think you have raised a very, and honestly, if all doctors were like you in India, I think that things would have changed so much. It would have transformed completely. And I personally do, align with the Vedantic idea, which you mentioned, which is that we are all one essentially. And, if we personalize that experience, we personalize service, the whole sentiment of service, and I think we can make a big difference. I also do admire the fact that you take your inspiration from Sri Satya Sai Baba's, teachings and views, ideas. So how do you see his vision and ideas informing the modern generation, informing society, and also the work and sector that you are currently in?
Yeah. So to me, Sri Satya Sai Baba is my savior, my guru, my everything. And he really encapsulated this deep wisdom in very, very small, very short, easy to understand idioms, where he said, "Love all, serve all." And how can you love all and serve all? When you start loving everyone and serving everyone, then you realize everyone is only me. And he said, "Help ever, hurt never." When you come from that mindset, then how can you hurt any other feelings, any other person? So the violence in our thought, word, and deed will disappear if we, promote this. There is no one, at least, who has ever been and can ever aspire to be what he has done for us, us human beings, and continues to do, through his guiding principles and through his programs and so on. He's built, literally hundreds of schools, many hospitals, which are models of healthcare, free education, free water, free food, nutrition, Like he inspired a group of young IT professionals in Bangalore to start, giving breakfast to children from poor families who are going to the school on a hungry stomach, because parents are both laborers, they're working, they leave home early in the morning. The child wakes up, drinks some water, and goes to school. You know, and so he inspired these few IT engineers to serve breakfast, and now that has become a massive program where they have served about 26 million breakfasts. They are serving every day 500,000 children every morning a warm, well cooked, nutritionally balanced breakfast is being given. Why is that important? Well, this is what I talk about in terms of uh, do you want to put a band-aid on some disease, or do you want to, enhance health, uh, build the causes of life? So when a child is sleeping at night, they have big releases of growth hormone in their body. So, whatever metabolic fuel is available in the body, in terms of protein or carbohydrate or fat, is used up for growth and brain development and organ development and all that. So, when a child wakes up in the morning, the body has completely depleted anything that was available in terms of fuel. And so, then if the child doesn't get breakfast, and they are waiting until the midday meal, which again another NGO like Akshay Patra has massively distributed. Um, they're running on empty. They're running on an empty stomach. So whatever growth had occurred during the night, those muscles are broken down, those brain cells are broken down in order to supply the fuel for the brain to be able to pay attention in class. So just by simply giving them a hot, nutritious breakfast, it has these children are growing faster. They have better academic scores. Their brain development is better. Now, if they're going to a school and serving breakfast, obviously these volunteers are looking at the toilets. So new toilets are being built that are more hygienic. Girls have a separate, area. So it has increased attendance. There's less absenteeism. Kids are eager to get to school because they have a nice nutrition and a loving person who is serving them the meal. So I think if these problems can be overcome, it just needs visionaries to be able to see every problem as an opportunity. And I have great expectations from your generation to be able to solve these problems in beautiful, innovative ways, which I can't even think about.
And I hope so, definitely. We did host actually Anand Kadaliji from this initiative that you spoke of, and we had quite a long discussion about how this actually helps in a comprehensive manner. I mean, education, healthcare-wise, empowerment. So it's not just about that food; it's about so many other factors which are affected by just that act of giving them breakfast, basically. Right. So coming back to the medical side of things. I mean, we did discuss about accessibility and quality. And sometimes it's seen that the governments have not been able to reach the last mile when it comes to tertiary or quaternary care. And in that respect, the public-private partnership model, where you have certain kind of entities which either from the private sector or even sometimes the NGOs or other initiatives come into the picture, how can they work together to kind of address the issue of access and quality of healthcare when it comes to especially patients from underprivileged backgrounds? For instance, I mean, in tribal areas in India, I personally have been to certain places in Madhya Pradesh and in the Northeast as well. There is still a lot to be done on those fronts. And at times, these other entities have worked with the government to kind of facilitate that action which is required. So what are your thoughts on that? And how has your initiative as well kind of helped in that direction?
So I think what this is clearly an example of a public-private partnership, um, where in the words of Sri Satya Sai Baba, he says the Samaj and Sanstha and Sarkar, all three must come together to help the people. So, so I think it doesn't matter where the initiative starts. It can start on the NGO side. It can be a foundation or a group of people who are inspired to solve a particular problem, or it can start at the government level. But rather than look at the government programs as entitlements or as something that one can sort of benefit from without giving back, I think society needs to step up to the plate and say, the government is doing so much. What can we do? And this COVID-19 has shown it has literally leveled the playing field, because it's affecting the richest and it is affecting the poorest, without any distinction or discrimination. Um, so, person like Amitabh Bachchan, got COVID-19. So, what else is there to and so even through this pandemic, even through this dire period of time, there are so many who have come out to serve meals, to give clothing, and certainly I know of not one, two, but 1,000 different programs that have started up, inspired by Sri Satya Sai Baba or other spiritual leaders, or maybe not even spiritual leaders, maybe just a wise man in the village. So somebody asked Mahatma Gandhi, they asked him sort of, who are you? This was a reporter from the West, he said, who are you? He says, well, I'm not a politician. People think I'm a politician. I'm not a politician. I'm not even a social reformer. I'm not a social reformer or activist. The British government thinks of me as an activist. No, he says, I'm a simple man in search of God. Those were his words. And so basically, I think the wealth of our country lies in our spirituality, and these problems, the last mile, can be solved in innovative ways through the public-private partnership in many different ways. But what is needed is that you must have the stakeholder involved in the decision making. It's not this top down, oh, we have a solution, we worked it out, this is your problem, we'll come and solve your problem. Doesn't work. And one of the programs that I'm involved with fairly closely is with Amrita University, which has been inspired by Mata Amritanandamayi Devi in Kochi, or near Kochi in Kerala. So they have this, through the Amrita University, they have these live-in labs where they send groups of students and faculty and researchers, and those people go and live in the villages for like 2 months or up to 6 months. And they co-create the solutions with the villagers. So once they've sort of created, they come back to the lab, they design something, they take it back to the village, and so on. And because the villagers are involved in co-creating these solutions, there is immediate deployment. The acceptability is very high, because it's not the problem that we identified and we solved for the villager. It's what they considered as their big problems, and they've participated in developing these solutions. And so that's how this last mile access, these private public partnerships, it must involve the end user, the stakeholder. Even the top IT companies, Apple and Google they always involve the end user, and their prototypes are built, distributed, and they need user feedback in order to, get the product to be the best. So that's where I think there are very few people who go and ask for the opinion of those who are in the slum areas, the jhuggi jhopadis and all that. People are looked upon, down upon, So we need to get over that. They're human beings just like we are, and involve them in helping solve their own problems.
Beautiful. It has been such a wonderful conversation. I would like to end by asking you about your, vision and directions and steps you want to take moving forward, particularly with respect to your initiative and, in general.
Okay. Well, I think the Sanjeevani Hospital, which started as one tiny hospital in a rural area in Chhattisgarh, is now become an iconic system. And it is really setting the pace at which healthcare delivery can be accomplished. And they have more than 200,000 families have benefited from this initiative. Consultations, about 112,000 consultations, 9,300 9,700 pediatric heart surgeries, cath interventions, cardiac cath interventions, about 3,100, and then the outreach screens, about 90,000 children and families. So what needs to happen now is to be able to support these and create like a hub and spoke model. So, and it is already starting to happen at the Sanjeevani Hospital. There will be these 4 or 5 diagnostic and follow-up centers, which are closer to the communities from where the children have come, and where they can come back, get an echocardiogram, get their ECG, get guidance on what to do next and how to bring their child into a normal childhood. So the vision is that this is directly from Sri Satya Sai Baba. The vision is that he wants to build a total of 7 Sanjeevani hospitals in the country, and about 250 of these diagnostic and follow-up centers. But he also is building capacity. He's building training programs for doctors, surgeons, physicians, nurses, ICU nurses, physical therapists, dietitians, radiology technicians, everything, echocardiographers, so on. He's building capacity in these training programs. And ultimately, he wants to have like 250 teams that can be deployed at any point all over the world. And this is not only happening in India. Sanjeevani hospitals are starting to come up in other countries as well. At the hospital in Raipur, more than 30 children from 30 different countries had received their care. And our teams have gone out and done heart surgeries, even in war-torn areas like Syria, in a classified, mission that they did 25 heart surgeries over there. So, there is a new hospital, a Sanjeevani hospital that has been built in the Fiji Islands, which will serve 16 of the South Pacific nations that have no access to cardiology or cardiac care for children. There are other hospitals being built in Sri Lanka, in Malaysia. There may be a hospital coming up in Afghanistan very soon. And in Nigeria, absolutely. Nigeria is another. So these hospitals, and his vision is that he will have 250 teams that will be deployed, will be sent all over the world to provide free of cost, high quality, high, expertise, specialized expertise care in multiple different areas. And I think that will be a model that will literally allow even the developed nations to consider, what are we doing with the commercialization of healthcare? We just need that a way of doing things that is a better way, and that will. I just forgot to mention, when a child comes to Stanford and we take care of them and do a heart surgery and all that, the hospital bill is about $250,000 to $500,000, so $500,000. Um, in India, congenital heart surgery costs anywhere from 5 to 15 lakhs. So, you can do the calculations, anywhere from like 4,000 to $12,000, something like that. But at the Sanjeevani hospitals, the average cost of one surgery is only $1,400. That's the kind of efficiency and care. We have 6 operating rooms at Stanford. We do 2 or 3 surgeries a day. They have 2 operating rooms in Raipur. They do 10 to 12 surgeries a day. We need to learn. We need to learn some process flow, patient flows, and things like that, coordination of care, in order to be able to get to that level of efficiency and effectiveness and cost effectiveness. So that is the great iconic model that Sanjeevani is presenting to us.
I think that's stellar work out there. I think it's absolutely amazing the way in which you have brought quality healthcare, quality tertiary, quaternary, primary healthcare. We have covered things like outreach in this discussion, access, quality. But I think the important point here is the paradigm shift almost in the way in which healthcare is conceived and delivered. Right? It is a more personable, it's a more personal kind of idea of service which drives this healthcare. And this is what I think India, and our entire culture as such, especially Sri Satya Sai Baba's vision as well, I think informs and brings forward. So it was a real pleasure, Dr. Anand, to host you today. And thank you for joining us, and good luck with everything that you are doing currently, and hope that it reaches newer heights.
Thank you. Thank you very much.